Hello, my name's Leah Hipsley. I'll be your nurse today. Can you tell me your name?
Tyler Hipsley,
Can you tell me your date of birth?
6/23/73.
All right. I have a few other questions for you. Can you tell me where you are right now?
In my house,
Can you tell me what year it is?
2024.
And can you tell me who the president is?
Joe Biden.
And can you count by twos to 10, please?
2, 4, 6, 8, 10.
Very good. Okay, so first I'm going to start off by checking the general appearance of your skin. I'm going to check for color, any diaphoresis. I'm going to palpate the skin for temperature and texture. So I'm going to use the back of my hands. Feel here, here. Okay, so your skin is warm and dry. I am going to inspect your hair. If you can tilt your head down for me. So I'm inspecting the hair for overall distribution of the hair. I'm checking for hygiene. So this has equal distribution and good hygiene. You can tilt your head back up. I'm going to palpate the scalp for any masses, lumps, abnormalities, anything like that. Okay, very good. Now I'm going to inspect your nails. So if I can see your fingers, please. I am checking for ridges, cracks, clubbing of the nails. These look good. I'm checking for capillary refill, which is less than 2 seconds. Good. I'm also going to check on the toes. Any clubbing, fungus, cracks, anything like that. Capillary refill, less than 2 seconds. Very good. Now I'm going to check your head and your face. I am going to inspect your face for symmetry of the facial features. I am going to palpate your sinuses, so your frontal sinuses and your maxillary sinuses for any tenderness. Does that feel okay?
Yes.
Okay. Now I'm going to test your trigeminal nerve. This is the nerve that is responsible for giving you sensation in your face. So I'm going to use a cotton ball here, and I'm going to gently swipe on 3 areas of each side of your face. Just say yes when you feel me, okay?
Yes. 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 Yes.
Very good. Now I'm going to palpate the masseter muscle, which is responsible for giving your jaw the motion of chewing. So I'm just going to feel right here. I'm gonna have you open your jaw, close your jaw. Very good. I'm gonna have you make a few facial expressions for me. So if you can just smile, frown, close your eyes tightly, open them, puff out your cheeks, and puff out your lips in like a kissing motion. Good. Okay. Now I'm going to examine the neck. I am looking for symmetry. I'm looking for any abnormalities. I'm checking the neck veins, and I'm going to check for jugular venous distension. Just going to palpate the sides. Good. Next, I'm going to check your trachea. I'm going to check for positioning of the trachea, excuse me. Just kind of put right in here. Okay. Trachea is midline. I am going to palpate your thyroid next. So I'm going to have you take a drink of water. Just don't swallow until I say. So take a drink of water and look to your left for me, please. Okay, now swallow. Very good. I'm gonna have you take another drink of water. Don't swallow until I tell you. Turn to your right and swallow. Very good. And take the water. Thank you. Okay, next I am going to palpate lymph nodes in 9 areas. So I'm going to first start behind your neck. I'm going to check the side of your neck. I'm going to check behind your ears, in front of your ears, underneath your jaw, and here in front. Very good. Next, I'm going to have you shrug your shoulders up and down. 1 time. Good job. Now push against resistance. Go ahead. All right. Very good. Okay. Next, I'm going to check your eyes. I'm going to inspect the appearance of your eyes. I'm checking for any edema. bruising, any discoloration, drainage that may be coming from the eyes. I'm going to inspect the sclera for signs of jaundice, any yellowing. I'm going to inspect your pupils. So I'm going to use a pen light here. I'm going to check and make sure that they are equal, round, and reactive to light. So I'm going to have you look straight forward for me, and I'm going to flash this light in the corner of your eyes to see if your pupils react to light. Very good. Okay. Next, I'm going to use a Rosenbaum card. I'm going to have you cover one of your eyes and read a line of numbers for me, and then I'm going to have you cover your other eye and read the line as well. So I'm going to stand back here. I'm going to have you cover your right eye for me and read this line.
2, 8, 4, 3.
Very good. Now cover your left eye and read this line.
2, 8, 4, 3.
Okay, very good. Next, I'm going to check your peripheral vision. So I'm going to hold up fingers in the corners of your eyes. You just tell me how many fingers I'm holding up, okay? Good.
1, 2, 1, 2.
Very good. Now I'm going to check the 6 cardinal fields of gaze. So just follow my finger for me, please. Very good. Now I'm going to be checking your ears. So on both sides, I'm just going to visually inspect the outside of your ears. Make sure there's no drainage, no abnormalities, no masses, lumps. Just gonna look on the outside. And then for the inside, I'm going to use a pen light. I'm going to be pulling out and up to check inside the ears. Okay. Next, I'm going to do a hearing test. So I'm going to be whispering on both sides. Just say yes when you can hear me. Okay?
Yes. Yes.
I would also use a tuning fork to do a Weber and a Rhine test. Next, I'm going to inspect your nose. I'm going to check for symmetry, lumps or masses, excuse me. Then I would look into the nares. I would again use my pen light and have you look up a little bit for me. Just check on the inside. Check for any redness, drainage, swelling, anything like that. Oh, let me actually keep this pen light because I'm looking to your mouth next. So I'm going to have you open your mouth. Can you say ah for me, please? Very good. I would actually put some gloves on for this because if you're going into a patient's mouth, you want to be sanitary. So we're going to do that again. Okay, open your mouth for me. Use this pen light, say ah. Very good. I'm checking, go ahead, you can close. Checking the tonsils, checking the inside coloring of the mouth. Making sure there's no swelling. I'm checking the uvula as well. Okay. I'm missing something. I don't know. Okay. Next, we're going to do the chest and lungs. So I'm visually inspecting the chest, looking for equal chest rise and fall. I am looking at respirations, making sure they are even, unlabored, checking the shape of the chest, and make sure he's not using any accessory muscles. I am going to palpate the front and the back of your chest using a Greek key movement. Okay. Move to the back. Yep, that would be good. Yep, perfect. Okay, very good. Now have you sit back again. Thank you. Okay, now I'm going to auscultate your lungs using my stethoscope, and I am going to do the front and the back, but I will start first with the front. So I'm just going to have you take some normal breaths for me. Very good. You can lean forward for me one more time. Going to be checking the back. Go ahead and take some breaths for me. Very good. Just stay seated like this. Okay, so his lungs are clear in all of the lung fields. Now I'm going to assess for CVA tenderness. So lean forward just a little bit. There we go. All right. So I'm going to have you say 99 3 times. So I'm going to check in 3 different areas. Ready? Go ahead.
99. 99. 99.
Okay. Very good. And lean back. Okay. Next, I'm going to check your heart. So I'm going to auscultate your heart in the aortic, pulmonic, Erb's point, tricuspid, and mitral areas. So what I am listening for is the S1 and S2 sound, which is the heart that the sound that your heart makes, excuse me. The S1 sound is the mitral and tricuspid valves closing. The S2 is your aortic and pulmonic valves closing. If you heard anything other than S1 and S2, like an S3, that would be a heart murmur. I would have the patient sit left lateral or forward to bring the heart closer to the chest. Now I'm going to palpate the temporal arteries, not at the same time, so right up here. Okay. I'm going to palpate the carotid arteries, just take a feel here. And I'm also going to palpate the peripheral pulses, so a brachial on both sides. Radial on both sides. Okay, going to check behind your knees. Well, there's pulses. Okay. And on top of the feet, your dorsalis pedis pulses. Very good. Okay. Now I'm going to assess your abdomen. Normally the patient would have his shirt off or be in a hospital gown for this portion. You would visually inspect the abdomen for any abnormalities, any masses, lumps, deformities that you may see. Then you would auscultate vowel sounds in all 4 quadrants with the stethoscope. Patient has active vowel sounds, then I would lightly and deeply palpate the abdomen in all 4 quadrants to check for tenderness or abdominal guarding by the patient. So lightly first. Any pain or tenderness?
No.
Then deeply. Any pain or tenderness?
No.
Okay. I am also gonna have you sit forward one more time for me. I am going to palpate the kidneys and the liver. So what I'm gonna do is place my hand back here lightly, and then I'm gonna give it a light tap, just to see if you have any pain or tenderness, okay? Let me know if you feel any pain. Any pain?
No.
Pain?
No.
Okay. Let's see. Lastly, I'm going to assess the musculoskeletal system. So if you can just do me a favor and lay down here on this lovely hospital bed. Okay. So I'm visually going to inspect the musculoskeletal system for any bony deformities, any obvious abnormalities that I may see. Then I am going to have you, how would we do this? Normally the patient would be laying down. So lift your legs up for me. I'm going to have you take the heel of this foot and put it on your knee, on this knee. Very good. Now, nope, put it back. Then I'll have you put your leg to the outside. Yep. And now bring it back in and then bring it to the other side. Yep, there you go. All right, put it down. Thank you. Now to the other, same thing. Yep, put it out. Very good. Now back in. Perfect. Okay, you can put it down. Then I am going to have you swing this leg. So put your legs out straight for me. I'm gonna have you swing your legs over this way and over this foot. You can do that for me. Out and over. Very good. Now with your other leg. Out and over. Very good. Now keep your legs out straight like that. Now push up against my hands for me. Very good. You can lay or sit up now. Sorry. Okay. Now I am going to have you, how do we do this? Okay, your arms. Put your arms out this way in a fist motion. Put them out this way. Now this. Very good. Back out. Okay, now palms up, palms down. Now do your wrists up and down, fingers out, fingers in. Very good. Now if you can just squeeze both my hands for me. Very good. All right, I'm gonna have you stand up for this portion. I am going to have you, here, step forward this way a little bit more. Okay, good. I am going to have you kick your leg backwards. Very good. Now go back. And your other one. Good. Okay, I'm gonna have you reach down, touch your toes. Very good. Come back up. Then I'm going to have you rotate your body to check for hip range of motion. So what you're gonna do is hands to your side. Look to your left. Very good. Now come back to the center. Look to your right. And back to the center. Okay, I'm gonna have you sit back down on this chair. Good. I am going to have you point, here, bring your legs out for me. Point your toes up to the sky, down to the floor. Now push against my hand. Good, and this way. Very good. Okay, thank you very much. I appreciate your time.